Hello, my name is Jason Suggett, and I'd like to thank the organizers of the conference for giving me the opportunity to talk today. The title of the presentation is Medication Delivery of CF Drugs via Breath Actuated Nebulizer, Review of Delivery Performance versus a Breath Enhanced Nebulizer, commonly used with such medications. Before we get into the presentation itself, just a brief disclosure. I work for Trudell Medical International in a research and development, scientific and clinical capacity. So in introduction, medications to manage care of cystic fibrosis patients are often delivered via a nebulizer. Such treatment is generally easy to use and enables delivery of the typical doses needed. A breath-actuated device will reduce fugitive emissions and provide dose assurance, because dosing is not dependent on breathing pattern. However, there are sometimes questions around the dose delivered to the patient when changing between a continuous and a breath-actuated delivery device. So this study compares the two delivery modes for a number of commonly used CF medications in the home. On this slide, we compare three different types of jet nebulizer. So the traditional continuous nebulizer, a breath-enhanced continuous nebulizer, and a breath-actuated jet nebulizer. In the middle, we have the inspiratory-expiratory breathing cycles and showing how the aerosol is produced throughout that cycle. And on the right-hand side, we have video clips of example devices from each category. So if we look at the continuous jet nebulizer, the inspiratory-expiratory breathing cycle, throughout that, aerosol is produced at a constant rate. So that's okay when a patient is inhaling. It's not okay if the patient is exhaling and nebulized aerosol continues to be produced and emitted from the device as fugitive emissions, or if they take a break in treatment and remove the device from the mouth. With a breath-enhanced delivery system that's continuous, then on inhalation, the amount of aerosol produced is enhanced, which is good. However, on expiration, then the nebulizer still continues to produce aerosol. Hence, you still see the fugitive emissions and you still waste medication that could have been used for inhalation. And finally, with the breath-actuated delivery system, here you only produce aerosol on inhalation. And that means you can maximize the amount on inhalation, it's still breath-enhanced. However, on exhalation, you no longer get that aerosol produced, so you don't get those fugitive emissions from the device when the patient's exhaling, and you also, if there's a break in treatment, you stop the aerosol being produced and reduce fugitive emissions that way. This means that medication delivery in this type of system is independent of the inhalation-exhalation ratio, and it's also independent of breaks in treatment. And it significantly reduces fugitive emissions. In the study, 4 different medications were evaluated: 7% hypertonic saline, Tobramycin, Dornase alpha, and Colistimethate sodium. Delivery was compared for each with a breath-actuated device, in this case the AeroEclipse breath-actuated nebulizer, paired with the Ombra tabletop compressor, and a continuous breath-enhanced nebulizer, the Pari LC Plus, paired with the Pari Boy compressor, was compared to it. And then the medication delivery was compared using data from existing laboratory studies in terms of the performance measures reported in each study. So in terms of the results, firstly, for 7% hypertonic saline, here the data is reported as fine droplet fraction, so the proportion, the percentage of droplets less than 4.7 microns. Therefore, those droplets that are in the size range that typically could be delivered to the lungs. And the breath-actuated nebulizer had slightly smaller droplets than the breath-enhanced, at 80% compared with 70%. With Tobramycin, here the two systems are compared, and again, the fine particle fraction showed that the breath-actuated AeroEclipse had slightly smaller droplets than the breath-enhanced LC Plus, around about 72% versus 64% fine particle fraction. Total mass was 140 milligrams for the AeroEclipse and just over 83 milligrams for the LC Plus. So more drug was delivered, and we'll come back to that later. For Redoinase alpha, the performance here is reported as fine droplet mass in micrograms. And the AeroEclipse breath actuator system produced approximately 430 micrograms in the therapy treatment, compared with the LC Plus Breath Enhanced that produced around about 350. So again, a little bit more delivered with the breath actuated nebulizer system. And finally, for colistimethate sodium, here on this study, the data had been reported as cumulative mass of colistimethate sodium droplets less than 5.4 microns. So that mass of droplet that would likely be delivered to the lungs, and was compared over time of the whole therapy treatment. Here you can see that both systems ran at a similar output rate. However, not surprisingly, the continuous system ran out of medication sooner, and the breath actuated system that was conserving medication ran a little bit longer and therefore delivered a little bit more drug. The summary table here compares all 4 medication systems and the metrics reported for each. And as I mentioned on each of the 4 previous pages, we can see that the breath actuated system delivers slightly smaller droplets and also a little bit more medication than the breath enhanced system. So in conclusion, although the medication delivery in the various lab studies was reported using different metrics, a common trend was that breath actuated nebulizer delivered at least as much or more medication than a breath enhanced device in each case. It's not really surprising, given that a breath actuated system does conserve medication that otherwise would have been lost as fugitive emissions. What we need to look at is the impact of delivering that slightly more medication. And when we reviewed the safety data for the drugs themselves, we saw that the higher delivery with the breath actuated nebulizer was within acceptable dosing ranges during development and clinical studies of these drugs. So on the basis of these studies, clinicians could select the breath actuated nebulizer for delivery of CF medications, with the added value of a breath actuated system offering low fugitive emissions and also improved dosing consistency. Thank you.